Good evening to everyone and welcome to today's wonderful evening. Past 3 days, I could not be able to catch up with you all guys, but definitely every day we will have an hour of session together, all 365 days, in order to add that required ignition into your preparation. So tomorrow we are launching the Incus learning app, which is 3-minute short videos. Any student, any teacher, any learner can be able to upload. It's not that only teachers upload. While you are doing revision, you can upload. Not only video, you can even upload image, handwritten, mnemonics. People can bookmark, can like you, can share, can become your fans and followers, and that's how you become a part of a large learning community. So TikTok styled 3-minute learning videos. I will also put a lot of learning videos free for inspiring you every day to prepare with energy. So NEET PG preparation basically has a lot of lists, a lot of numerics, a lot of logical points to basically remember. So to make the life easier, the Incus learning app will give you an opportunity to add up your part of wisdom, your 2 cents of wisdom in the form of 3-minute learning videos. I want all of you, while you are studying, just record it and then upload it. Just like TikTok, it is very easy to upload the video. So let's make the great beginning, doctor. Today we'll start radiology. There is some part of ophthalmology left over. I will finish it, but today we are in a great mood for radiology. Which investigation does not use ionizing radiation? This is the fundamental biscuit question. Everyone knows it is MRI. So what is true and false about the utility of ultrasound? If you want to negotiate a central venous line, if you want to insert a central venous line, ultrasound can be used. It is used to access the diaphragmatic movement. It is useful in trauma, etc., etc. A patient with carcinoma endometrium is treated with pelvic external beam irradiation, which is the most radiosensitive part in the pelvic area. Something which is continuously proliferating is radiosensitive. So that is the reason ovary, with all those ovarian follicles, which is having a very high regenerative capacity, is at a great risk of getting affected with radiation, is what you need to remember. So in the given X-ray, what you are able to see? You are able to see cervical rib. Cervical rib. Now comes a very interesting question. Generally, we will not be very good with ultrasound. So examiner's question, what is this sign? इसको देखें तो आपको क्या दिख रहा है? Seashore. You are able to see seashore sign. अच्छा भैया, ultrasound of the lung. By now you understood that ultrasound of the lung is in the examiner's question bank. इसलिए anything, everything about this, you want to be 100% sure when you go to the tomorrow's NEET PG exam. See, doctor, if you look at the normal lung, typically there is an area where the chest wall is there. There are no waves, no motion, chest wall. Then you have the motion, which is the lung, typically it will appear like sand because it is air filled. But if there is a pneumothorax, the entire lung is being pushed by the air inside the pleural cavity. So that is the reason जहां sand होना है, sand नहीं होगा. So there is no motion lung. There is no motion because of the chest wall. There is no motion because lung got compressed and replaced by air. So this is called the stratosphere sign. Is what you have to basically remember. And this also reminds us the barcode. So barcode sign, stratosphere sign का मतलब क्या है? जहां sand के जैसे air filled lung दिखना है, that lung is being pushed by the air inside the pleural cavity, and there is no motion which otherwise the lung will have. That creates the stratosphere sign. समझ में आ गया ना? Now, if you do the Yum mode of the lungs, this is the area which is called sky. These are the waves, and this is the sand, right? So this is the sand. So above the pleura, the scan reveals wave-like lines generated by the movement of the muscles, which are the waves. These are the waves. And the skin, which is the sky. And underneath the pleura, the image shows this grainy pattern resembling the sand, which is like the sliding lung, is what you need to remember. Once more, the ultrasound of the lung, the pleura is visualized like a hyper-echoic horizontal line which is moving synchronously with the lung movement with every respiration. So all these are very practical things, very everyday ultrasound में देखने वाला चीज होता है. So that is the reason to make this preparation more interesting always. Just walk in and ask your resident in casualty, भैया जरा अल्ट्रासाउंड में लंग कैसे दिखता, प्लूरा कैसे दिखेगा, जरा एक बार दिखाओ बोले तो it will be more interesting, right? So that's the point. So I'm talking to a lot of medical teachers. There are almost all 50,000 medical teachers across country. Every specialist love to teach something to the younger generation of medical students. But unfortunately, what happens is some of the great clinicians, they're not in the medical colleges. So that is the reason I am reaching out to everyone. Incus app download करो, TikTok के जैसे 3 मिनट के वीडियो में one practice point को demonstrate करके दिखाओ, and then simply upload it, and it become available for all the students across the world. Africa में, नेपाल में, बांग्लादेश में, Japan में, everywhere medical students are medical students. So it becomes a learning content. A lot of our medical consultants are uber happy. Wow, very good idea. So tomorrow Incus Learning app is launching. If you go to Google Play Store, you type Incus, you get the Incus Learning app. और आप भी जब पढ़ाई करते हुए, while you are studying, make it more interesting. So just to do a revision. Suppose you are a little shyful that, oh, I don't want to show my face. Then you can also even write something and then only audio you can record. So that is also, you demonstrate on the paper and then record the audio. 5 points, 2 points, 3 important points. वैसा short bite-sized videos बना के Incus app में upload करो and win friends, fans, followers. So, doctor, this is the typical plural line. This is the rib. Yahan bhi rib. So the back of the bat represents the plural line. Below that, the body, typically, you can be able to see the intrapleural space with no fluid and moving with respiration. So this is the typical bat wing sign. Now in this context, you should know what are the B lines, A line, etc., etc. So these are the short vertical lines. Yeah, dikh rahe na aapko? So B lines are the short vertical lines under the pleura. This is all pleura, right? Under the pleura, you have the B lines. B lines. And why do they appear? Because between the visceral and parietal pleura, there is a small amount of fluid between the two layers of pleura. Because of that, you see the B lines is what you need to understand. Acha bhaiya, different probes hota hai. You have a linear array high frequency probe, 5 to 13 millihertz. This is how much? 5 to 13 megahertz. So mainly to analyze the superficial structures like the pleural line and providing better resolution, we use this. Curvilinear array, 1 to 8 megahertz. It is for the deeper lung structures because it provides a better penetration but low resolution. Then phased array, pura cardiologist istri marte na, gum laga ke. So typically this is the cardiologist probe. This one is the cardiologist probe. It has got a flat, smaller footprint, and between the ribs you have to image the heart. So that is the reason phased array probe 2 to 8 megahertz is what you see with the echo machine. So what is the technique you basically employ? The probe is placed in the sagittal position in the anterior chest wall in the second intercostal space in the midclavicular line. That is a typical position. And the moment you see the bat sign, where you have the ribs and the pleural line and the B line, because the intrapleural fluid, that means you identified the lung and the movement, basically. So if you look at pneumothorax, what's happening in pneumothorax? You have the lung, doctor, right? You have the lung. Around the lung, you are having the pleura, right? You are having the pleura. But if there is a lot of air into this pleura, then what happens? This lung become completely shrunken, and this is all filled with the air. So typically whenever there is air, when the patient is in supine position, all that will settle down between second to fourth intercostal space in midclavicular line. So that is the reason whenever there is any trauma, you want to do a quick screening whether there is any pneumothorax, then the recommended initial area is the second to fourth intercostal space in the midclavicular line is what you need to remember. So this is the rib. This is the skin and soft tissue, the pectoralis muscles, and this is the rib and intercostal muscles, and this is the lung, and this is the pleura. This is the pleura, is what you have to understand. So in this context, you should know pleural line or a sliding sign. So whenever you find a hyperechoic pleural line in between two ribs which is moving back and forth, then you find you need to look for the seashore. So as I have already explained you, all this sand represents the lung, which is filled with air, is what you need to remember. So you need to look for, first identify the plural line and then look for the sand and the seashore. So the bat winged sign, the plural line, and the seashore sign, and the bee lines or the comet tail artifacts is what you need to remember. Now, there are 2 points you need to know about the bee lines. First of all, why do you get to bee line? You get bee line because there's a small amount of fluid between the visceral and parietal pleura, because of the small amount of fluid between visceral and parietal pleura. And if there is too many bee lines, that means there is interstitial edema. That's what you need to remember. Now, what are A lines? A lines are also a reverberation artifact. So equally spaced 2 horizontal hyperechoic lines. Generally, in a normal lung, your B lines will erase the A line. A line is a prominent area. That's what you need to appreciate. Now, whenever there is any pneumothorax, what do you see? The lung sliding become absent. Comet tail artifact is there no B line. They become lost. There is a broadening of the pleural line to A band, that horizontal bands. They become prominent. And the change from the seashore into a stratosphere or a barcode when you do the M mode, motion, ultrasound. These are the longest findings in pneumothorax, is what you have to emphatically remember. So this is the typical lung sliding sign, doctor. So if that sliding movement is there, means lung is contracting and expanding. That means it rules out the pneumothorax. So it is the presence of this sliding that rules out the pneumothorax. But the absence of the sliding does not prove it is pneumothorax. It has no proving effect, just like Mantle. It does not have a proving effect. Only thing is it has the presence of the sliding rules out. That is very strong. That is very strong. And there are many other conditions where the sliding of the lung, other than the pneumothorax, also can lead to loss of lung sliding. Like whenever there is an ARDS, pulmonary fibrosis, large consolidation. Similarly, pleural adhesions, atelectasis, or any phrenic nerve palsy, anything can cause the loss of the lung sliding. So absence of the lung sliding is not diagnostic, but the presence of the sliding rules out the possibility of the pneumothorax, is what you have to emphatically remember. So you can see how the lung point in the pneumothorax. So, doctor, A lines are the thoracic artifacts for diagnosing pneumothorax. So, they are the horizontal lines. Normally, the B lines will prevent them to appear, but the absence of the B lines in the case of the pneumothorax will make the A lines to appear prominently, is what you need to remember. So, there is one sign which is considered to be 100% specific for the pneumothorax. So So what is the meaning of, what is that sign? So lung point sign, it occurs at the border of the pneumothorax. It is helpful in determining the actual size of the pneumothorax. And to show the lung point sign, you need to use M mode, where you find alternating seashore and the stratosphere. That means if the lung is there, let us say this is the, so typically the lung is being condensed and this is all the air. जहां एयर होता है आपको स्ट्रेटोस्फियर होता है, और जहां लंग होता है वहां सी शोर होता है. So alternating seashore, then stratosphere, seashore, stratosphere. That is called lung point sign, which is an indicator of the border, Indo-China border between the lung and the pneumothorax. So larger pneumothorax, the size of the pneumothorax, you can delineate with the lung point sign. That's the reason it is considered to be 100% specific sign. Then lung pulse, the rhythmic movements of the pleura. Whenever the rhythmic movements of the pleura occur in synchrony with cardiac rhythm. So, suppose if the lung is poorly aerated, then दिल के धड़कने जो होते हैं, the cardiac vibrations, typically those cardiac vibrations will produce a rhythmic movement of the pleura, and that is basically called lung pulse, is what you need to understand. So let us summarize the algorithm of the pneumothorax, doctor. If the lung sliding is present, then there is no pneumothorax. If the B lines are present, then there is no pneumothorax. They rule out. But the lung sliding is absent. Look for the artifacts. If the A lines are present, then the B lines won't be present. If the A line is present, then the B line won't be present. If the B line is present, then there is no pneumothorax. If the A lines are present, look for the lung point. If the lung point where alternating seashore and the barcode are appearing, then the pneumothorax is present. That is the point you need to appreciate. So this is called seashore sign. So if there is a normal lung, normal pleura, everything normal, then you can see the seashore. Instead, you are able to see the barcode. Then that means there is pneumothorax. That's what you need to appreciate. So that is the story, doctor. I'm so happy to see 17 online classmates. Very good. Where is MRI is preferred over that of the CT? In Pankos tumor. Otherwise, in pulmonary embolism, pleural effusion, tuberculosis, CT is okay. But in Pankos tumor, which is the superior apical lobe lung cancer, there is a chance of compression of the superior vena cava, brachial plexus, everything. So MRI can be able to better delineate. A patient with pain abdomen for 2 hours presents to the casualty. Good to see Rifa Riaz and many more who are all online. This X-ray of the abdomen was obtained. So what do you see here? Air under the diaphragm, air under the diaphragm. That means it is pneumoperitoneum is what you should remember. Abhi aa gaya. Fast is a very important टॉपिक। हमने सर्जरी में भी इसका बहुत ध्यान दिया, सर्जरी डिस्कशन also. All that video lectures after the class is over, we remove from the YouTube and upload it into onlinembbs.com, and from tomorrow even into the Incus learning app, into the mobile app, so that you have all the videos available under the 1500 HD videos in 500 hours of discussion for the NEET PG crash preparation. वो कोर्स में आपको मिल जाएगा, ये सारे वीडियोस को अपलोड करेंगे, right? So in the Incus learning app also from tomorrow. So this is fast to positive is what you need to remember, because you are able to see fluid, na doctor? That's the reason. So typically the positive right upper quadrant fast view, which is showing the superior paracolic gutter around the caudal liver edge, which is most sensitive for detecting the free fluid, is what you need to remember. पहला ये एबनॉर्मल बोल के समझने के लिए नॉर्मल कैसे दिखाएगा. So this is the liver, this is the kidney, doctor. Between them there is nothing. There is nothing. Absolutely normal. So this is no free fluid in the Morrison's pouch. Similarly, this is the right upper quadrant fast view showing hepatodiaphragmatic space between the liver and the diaphragmatic space. There is no fluid. Good to see Shailaja and many more. Lot of students were requesting, sir 6 बजे को शुरू करेंगे हमारा हरिकथा कलेक्शन. I thought, भाई now exam नजदीक हो रहे हैं, so let us try to stick to a particular time every day. So 6 o'clock. And not only that, if you download the Incus learning app, then every 5 minutes, 10 minutes, there is one new video of 3 minutes duration. कुछ mnemonics, कुछ logical points, कुछ picture based MCQ revision, कुछ ना कुछ डालते ही जाएंगे. आप रिविजन करते जाओ और उसको बुकमार्क करो, लास्ट मोमेंट में रिविजन करो, उसको लाइक करो, शेयर करो, and you also upload, you also have a provision to upload 3-minute videos. If you are getting a lot of fans, viewers, likes, we will have some special prizes waiting for you for posting some of the innovative content, right? So into the Incus learning app. So this is the spleen, this is the kidney, and this is the diaphragm, and this is the typical kidney, spleen, diaphragm, and this is the spleno-diaphragmatic and spleno-renal space. Spleno-renal space. So always in any trauma, spleen is most unsupported structure. Rib के नीचे रहता है. It's very vulnerable for the injury, right? रिब्बा के स्प्लीन के ऊपर गिर गए, स्प्लीन जाके रिब के ऊपर गिर गए, बात एक ही होता है, स्प्लीन को नुकसान हो जाएगा, right? Now, what is this investigation? I think examiner is too soft-hearted. भैया इसको आजकल के CT-MRI के जमाने में ये क्या है बताओ? ये होता है myelography. You are passing a contrast and taking a simple plain radiograph. empty theca sign. Where do you see, doctor? Whenever there is arachnoiditis, then we see empty theca sign. So, doctor, thorax mein, there are some very interesting set of most common MCQs in radiology. So, next half an hour may I am going to make you the champions in the radiological science, the named radiological science in the thorax. Okay. So now, doctor, Silhout sign. What is the meaning of Silhout sign? Typically, whenever there is a intrathoracic lesion which is touching the border of the heart or the aorta or the diaphragm, then it will obliterate that border on the X-ray. So, whereas that means this is the heart, doctor. For example, let us say this is the heart shadow. Then you found another shadow. If this shadow is obliterating the heart shadow, then it is one of the intrathoracic lesion which is very adjacent to heart. And an intrathoracic lesion not anatomically contiguous with the border of the heart will not obliterate that border. So, where do we use the Silhout sign? So, typically, if you look here, you are able to see the left heart border very clearly. Whereas all this opacity jo bhi hai, it is obliterating the right heart border. Right heart border. Barabar, doctor. So, this is a classical example of Silhout sign. Because of the all this inferior part of the right lobe is having pneumonia. Because of that, the right heart border become obliterated is what you have to remember. Now once more you can see here. Left heart border you are able to see clearly, but the right heart border got merged into this opacity. Because there is a pneumonia in the right lower lobe. That is what you should realize. So, typically, an initial frontal radiograph was taken. There is a suspicion that by pneumonia hai bolke suspicion hai. And the right heart border, left heart border you can see clearly, but right heart border nahi dikh rahe. By next day, the pneumonia got expanded. And you are able to see the complete mnemonic consolidation. So, initially when the pneumonia is not fully visible, what is a clue that it could be pneumonia of the right lower lobe? The right lower border of the heart, the right border of the heart is not visible. It got buried. It is not very clear. क्लियर नहीं है. तो नेक्स्ट डे होते ही पेशेंट का एक्सरे में पूरा न्यूमोनिया अपना दशावतार दिखाया, पूरा अवतार दिखाया. So that is how the radiologists, poor guys, they need to look at shadows and make predictions like Nostradamus. कोरोना आने वाला है अंतरिक्ष से, right? Now, air bronchogram sign क्या होता है? Whenever there is any air space disease, then typically you can see that branching pattern. So you are able to see the branching pattern here. So this is how the right upper lobe pneumonia hai, this opacity, because this branching pattern you are able to see. And doctor. So that is called air bronchogram sign. Typically it happens whenever there is any pneumonia or atelectasis, consolidation, tumor, etc., etc. Very good. Raj Viday Gamer. I'm in final year, doctor. Very good, very good. Bade banke mal banega hamara Raj. So Raj, you tell all your friends in your college class, every day, all 365 days, 1 hour, Dr. Murali Bharadwaz will be studying along with you. I am also in final year, Raj. Every day evening, I become a NEET PG aspirant with all you guys for 1 hour. Free, absolutely free on the YouTube, right? So please do come, bring your friends also. And हम रोज मजे में एक 40-50 questions revision करेंगे, right? Every day. And also, Raj and your friends, ask them to download the Incus learning app, where you have thousands of clinical cases, real-time clinical cases are going to get published. And you also, when you see a very nice case, a supraclavicular lymphadenopathy, or a patient who recovered from the pancreatic carcinoma or a Whipple surgery, or you have seen a classical case of that bag of worms appearance of the varicocele, make it a point with the proper consent of the patient, of course. Try to get the story captured as to how the whole story started, everything. So you should listen to the stories of the people, doctor. How the problem started, when did it start. 5 times you heard that pancreatitis story, 6th time you can smell that this is the case of the pancreatitis. That is most important, right? So, very good. So this is the air bronchogram sign. Now, this is another place where you can see the air bronchogram. Yahan bhi air bronchogram. Yahan bhi air bronchogram. Typically in the case of the left upper lobe pneumonia. Very commonly, every day in and day out, हम X-rays पकड़ते, देखते भाई air bronchogram है, भाई pneumonia है, immediately high level antibiotics शुरू करो और culture के लिए भी जाओ, whether the patient responding or not, day in and day out, we do the assessment of the X-ray. Signet ring sign. Typically, whenever there is any bronchiectasis, there's a ring shadow which is representing a dilated, thick-walled bronchus. So whenever bronchiectasis is there, how does patient clinically present, doctor? He presents with cups and cups and cups of sputum. So the ring shadow representing the dilated, thick-walled bronchus associated with the nodular opacity representing the pulmonary artery. So it will have this one. You are able to see now? यहाँ दिखाएगा. ये दिख रहे हैं ना doctor? हाँ. That is the pulmonary artery and the dilated bronchus. Bronchiectasis is what you need to remember. Popcorn calcification, another favorite MCQ. पहला popcorn देख रहे हैं ना? हाँ, very good. आजकल तो वो मूवी थिएटर में जाना और भागते भागते अरे फर्स्ट सीन मिस हो गया बोल के और बैठना पॉपकॉर्न खाना, those days are becoming tough because of this stupid COVID. So popcorn you all know. So hematomas, which are benign tumors, commonly they present with hemoptysis. Hematomas typically present with a opacification which is like a popcorn. So what is popcorn? Sharply defined cluster of sharply defined irregularly lobulated calcification, usually in a pulmonary nodule, is what you need to remember. Tram track sign, another favorite MCQ, so many times asked in the NEET PG, JIPMER, DNB, everywhere. tram tracks. You all know the railway track. So like that, you find it, this tram track appearance. Tram track appearance. So typically, you should remember, tram track sign typically is seen whenever there is any bronchiectasis. They are nothing but the thickened, dilated bronchi which typically appear like tram track. So, any infection, bronchial obstruction, cystic fibrosis, primary ciliary dyskinesia of Cartaginer, anything can lead to tram track, bronchiectasis. Tree in bud. There will be small peripheral centrilobular soft tissue nodules connected to multiple contiguous linear branching opacities. So, linear branching opacities there is a connection. So, these are the tree in bud. Got it? So, now doctor, where do you see tree in bud? Typically, whenever there is any bronchial dilatation, mucus plugging, and the wall thickening in bronchiolitis, then all that will appear, and tree in bud appearance typically is a feature. That means all that mucus which is plugging will appear as tree in budding, tree in bud sign is what you should remember. So, what are the various causes that lead to the development of the mucus plugging leading to the tree in bud appearance? Any cystic fibrosis, cartilaginous syndrome, obliterative bronchiolitis. Initially, endobronchial TB also. Originally, endobronchial TB is the one which has got this tree in bud sign. Karnik Dhanush is saying, sir, you are doing a great thing. Doctor, hum to 23 years se we got addicted. Not only me. You take any of the coaching gurus of this country. हमको रोज बच्चों के साथ बैठना, 1 घंटा 2 घंटे टाइम पास करना, कुछ ना कुछ एंट्रेंस का डिस्कशन करना, पूरा 365 days. It's like healthy social drinking के जैसे है. We should all be thankful to you for giving us this opportunity. In fact, YouTube-like platforms today are giving that opportunity. So don't forget, doctor, the greatest thanksgiving will be if you bring another 100 friends of you. Every day शाम मिलेंगे Dr. Murali Bharadwaz के साथ चाय पे चर्चा. We will take up the classical questions, frequently asked question. खेलते खेलते टॉपर कैसे बनना नीट पीजी में. So that is the reason I'm all requesting you that tomorrow we are launching Incus learning app, where you can post 3-minute TikTok like short videos. P450 inducers, P450 inhibitors, कुछ मसाला निमोनिक है तो 3-minute वीडियो बना के चढ़ाओ और देखो what magic it will have. Students in Africa, students in Bangladesh, students in America preparing for USMLE, everybody will become your fan on the Incus. And not only that, you can connect with your fans, you can chat with your fans, and you too can follow some of the great teachers in the world. I spoke to a lot of neurosurgeons, CD surgeons, oncologists among my students. I said, by the time that you give back to the world, right? Of course, coaching programs are all commercial. What the baat ki baat? But most important thing is, who will teach? Who will, unless the wisdom is passed from one teacher to another student, how can the world survive? So that is the reason एक अच्छा clinical examination finding है, some tricky point in the clinical practice, some special surgical procedure they have done. कुछ जर्नल में पब्लिश करें तो क्या मिलेगा? कुछ भी नहीं मिलेगा, कोई भी पढ़ेगा नहीं. Even your own wife will also not read that journal. Give it over to the students as a knowledge, so that helps them as a practice point. So that is the reason a cardiologist watching a pulmonary embolism with a right ventricular dyskinesia because of a severe pulmonary hypertension with a high right ventricular systolic pressure with a high RVSP will demonstrate that in a 3-minute video, upload it live from the bedside into the Incus learning app, and you get an opportunity to learn practical things. So doctor, let us revolutionize the learning process. So CT angiogram sign का क्या होता है? Typically, you have given IV contrast material. If you do a CECT, contrast enhanced CT, so that lead to the CT angiogram sign. So you can see on the chest CT, typically all these markings, contrast fill, they look like the pattern you see on a CT angiogram. So the enhancing branching pulmonary vessels in a homogeneous low attenuating consolidation, ये पूरा consolidation है, लंग का consolidation, कुछ pneumonia है भाई, पूरा consolidate हो गया. Inside, so obviously when there is a consolidation, what will happen? There is a low attenuating area. In that low attenuating area, this contrast filled blood vessels will look like an angiogram is what you need to remember. So the bronchoalveolar carcinoma के लिए, this used to be a very classical clinical sign, because any tumor will have an increased blood flow, right? So pneumonia, pulmonary edema, obstructive pneumonitis with a central tumor or a metastasis from GI carcinoma, lymphoma. In any of these situations, say hypoattenuated area of the lung, maybe due to consolidation, maybe due to tumor, will lead to the blood vessels stand out in prominence, which is called CT angiogram sign. Once more, you can see within this mass lesion, all these blood vessels are typically appearing like with the contrast. Then finger in glove sign, क्या होता है? So these are the fingers inside the gloves. So यहाँ भी आपको finger in glove दिख रहा है. So typically whenever there is any obstructed bronchus with mucoid impaction, and that will lead to the contrast in the hilum area, typically with all that branching pattern, will look like the finger in glove sign. So there are two scenarios where this will happen. Non-obstructive causes and obstructive causes, any of them can lead to this kind of a insufficiency of the contrast and spread like a finger in gloves. So ABPA, asthma, cystic fibrosis. So ABPA is characterized by central bronchiectasis, leading to finger in glove sign. Similarly, obstructions like bronchial hematomas, lipomas, bronchogenic carcinomas, carcinoid, etc., etc. Similarly, congenital conditions like bronchial atresia, intralobar sequestration, anywhere finger in glove can appear. So this is another classical example on the chest CT, where you are able to see the presence of the finger in glove appearance. Then comes halo sign. There's one pulmonary nodule. Around that, there is a ground glass attenuation, which is called halo sign. So any neoplasm or an inflammatory condition leading to a hemorrhagic nodules will lead to this halo sign. अच्छा वो भी देखेंगे. So यहाँ halo दिख रहा है ना doctor? Halo sign. So typically in the case of the schistosomiasis, schistosoma typically led to the development of this halo sign. So depending upon the clinical setting, even Kaposi lymphoma can lead to multiple hemorrhagic nodules. Similarly, leukemia and fever, if you find halo sign, then that is indicative of invasive aspergillosis. Similarly, immunocompetent person with a solitary nodule which is showing a halo sign, think of bronchoalveolar carcinoma, is what you need to remember. अच्छा, रिवर्स हैलो साइन क्या होता है? रिवर्स हैलो साइन रिवर्स होता है. Typically, central part will be ground glass opacity surrounded by a denser area of consolidation. Denser area of consolidation. Whenever there is any cryptogenic organizing pneumonia, then you find a central halo with a denser surrounding consolidation. You are able to see, doctor? Once more, you are able to see reverse halo sign. Reverse halo sign. So it can be seen in cryptogenic organizing pneumonia, a very specific sign, and it is also seen in vaginal, neoplastic, invasive aspergillosis, schistosomiasis, etc., etc., etc. So that is the whole challenge of these poor guys called the radiologists. They look at shadows, they know possibilities, and they write all possibilities. It is the clinician who has to decide which possibility to be picked up. So now, coin lesion, क्या होता है? Any solitary lesion 1 to 5 centimeters in size, round or oval with a well-defined margin is called as a coin lesion. So this is a coin lesion. Lot of times patients will come to you, डॉक्टर साहब ये बताइए लंग कैंसर है क्या, मुझे एक कॉइन लीजन दिखा है. सो ऑलवेज यू शुड से ओल्ड एक्सरेस है तो लाओ भाई बोल के बोलना. सो टीबी, कोकिडोमाइकोसिस, हिस्टोप्लाज्मियोसिस, neoplasm, cysts, vascular anomalies, anything can lead to development of a coin lesion. Miliary shadowing, भैया miliary कब बोलते, coin कब बोलते? 1 to 5 centimeters size is coin. 1 to 4 millimeters, 1/10 of centimeter. Pulmonary nodules are called miliary. Right? It's a miliary. 1 to 4 millimeters is the miliary. I still remember this is a favorite MCQ. Favorite question in the ward rounds. So TB, histoplasma, sarcoidosis, rheumatoid arthritis, pneumoconiosis, COPD, even COPD. Pulmonary sclerosis, bronchoalveolar carcinoma, and certain metastasis presents like biliary lesions, thyroid, kidney, trophoblastic tumors, and sarcomas. Anything can be miliary. Monod's sign. What is Monod's sign? Typically, there will be air which is surrounding the fungus ball. A fungus ball surrounding that, there is an air which is typically called Monod's sign. Whereas there is a air crescent sign which is seen in the angio-invasive aspergillosis, where aspergilloma के surrounding area में आपको दिखाएगा. But if you find air crescent sign in a case of angioinvasive aspergillosis, it is a sign of recovery. That's a good sign. So this is another example of Monod's sign, where this crescentic shaped air shadow surrounding mycetoma you are able to see. This is another example, Monod's sign. Monod's sign. You are able to see in case of Wegener's granuloma, where there will be a cavitating lung lesion with hemoptysis as a clinical presentation. Fallen lung sign. So whenever there is a collapsed lung with a fractured bronchus, the collapsed lung comes to a dependent position, hanging on the hilum with its vascular attachments. अगर ब्रोंकस टूट गया तो और लंग नीचे गिर जाएगा, which is called fallen lung sign. So once more you can see a fallen lung sign in this given case. Fallen lung sign. Bulging fissure sign. So typically you have minor fissure, major fissure in the lung na. So whenever interlobar fluid collection होगा, तब ये fissure जो है वो bulge हो जाएगा. So bulging fissure sign, because Klebsiella pneumonia is leading to all this pneumonic patch and led to interlobar fluid collection, and that led to bulging fissure sign, which is classically seen in Klebsiella pneumonia, is what you need to appreciate. Flat waist sign. Whenever left lower lobe collapsed, the hilar structures will shift downwards. All the hilar structures. ये है ना, ये hilar, hilum जरा ऊपर रहना, मगर they will all shift downwards, which is called flat waist sign, which is seen in the case of the left lower lobar collapse, is what you need to remember. The golden S sign. Remember, each of this is a favorite MCQ of the examiner. Maximum 50-60 signs like that. Radiological sign, chest radiology में. वो गर्मा गर्म आपके फिंगर टिप्स में रहना है कल के नीट पीजी के लिए, because all image based questions are all from the radiology basically. So out of 300 you will have at least some 20-25 image based समझो, उसमें 5 to 6 questions radiology based ही होता है, right? Good. Now doctor, golden S sign. Whenever there is a right upper lobe collapse, the medial portion of the minor fissure is convex inferiorly due to the central mass, and the lateral portion of the fissure is concave inferiorly, like a S. This is convex, this is concave, right? So whenever there is any bronchial carcinoma, primary mediastinal tumor, metastasis, enlarged lymph node, anything leading to the right upper lobe collapse, then typically there is a S shape which will appear. Typically in this case it is a bronchial carcinoma. So this is another example of golden S sign, is what you are able to see. Golden S sign. Then bat wing appearance. This all of you know. Bilateral perihilar shadowing in a frontal chest radiograph. Whenever there is any pulmonary edema, especially cardiogenic pulmonary edema, so you can see the wings of the bat. So that is the reason, at least in childhood, we should read some comic books, right? So this is the classical bat wing sign. Ground glass pattern. So all this haziness This is called ground glass pattern. It's a very non-specific finding. It is because of the partial filling of air spaces, interstitial thickening, partial collapse of the alveoli, even during normal expiration. So pulmonary edema, ARDS, viral mycosomal pneumocystis pneumonia, hypersensitivity pneumonia, anything can lead to a ground glass appearance is what you need to remember. Crazy paving sign. Typically scattered, diffused ground glass attenuation which looks like a crazy paving. You should know. Initially, it was described in pulmonary alveolar proteinosis, but later on infection, neoplasm, sarcoidosis, respiratory bronchiolitis, anything can lead to crazy pavement sign is what you need to remember. So this is the crazy paving sign. Then comes mosaic pattern. Mosaic pattern. So typically this is the mosaic pattern. You're able to see the mosaic. This is mosaic. This is mosaic. So once more, infiltrative lung disease, airway abnormalities like asthma, bronchiolitis, similarly chronic pulmonary vascular disease like chronic thromboembolism. So you need to differentiate these three. In all the three, you can find this mosaic pattern. But how will you differentiate between them? So these areas of lung attenuation, doctor, these areas of lung attenuation. You look for the size of the pulmonary vessel in the area of the increased lung attenuation. It is increased. The size of the blood vessel is increased in airway disease and vascular disease, but not in infiltrative disease. Similarly, in the expiratory scan, you look for the air trapping, which indicates that this mosaic pattern is because of the airway disease, is what you should remember. Then comes the sandstorm appearance. पूरा स्टॉर्म आ गया, सैंड स्टॉर्म आ गया, वैसे दिखता है पूरा लंग को देखे तो पहले आप सैंड स्टॉर्म को देखना है यूट्यूब में. So whenever pulmonary alveolar microlithiasis is there, then that lead to the sandstorm appearance is what you should remember. Honeycomb. So this is all honeycomb, 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 honeycomb. So clustered cystic air spaces of 3 to 10 millimeters diameter. So typically it is the interstitial pneumonia to which it is very much diagnostic, and pulmonary fibrosis means honeycombing of the lung. So pulmonary fibrosis is a clinician's word, honeycombing is a radiologist's definition. Westermarck sign. Typically, what you are able to see, good to see Chandan Patra and many more. So this side you are able to see the bronchovascular markings दिख रहे हैं आपको, or I mean pulmonary vessels are also seen. यहाँ suddenly pulmonary vessels are not seen. So whenever there is any lobar or a segmental artery occlusion because of a pulmonary embolus, then there will be oligemia distal to the pulmonary embolism. So there is a reason Westermarck sign of the pulmonary oligemia because of the occlusion of the pulmonary branch, artery branch, is called Westermarck sign. So once more you can see this side, you are able to see all the bronchovascular markings, but this side you are unable to see, which is an important indicator, Western mark sign. Then the wave sign, आपको यहाँ एक wave दिख रहा है क्या? दिख रहा है. So whenever there is a thymus, what are the anteromediastinal tumors? 4 kinds of anteromediastinal tumors. T for teratoma, T for thymoma, T for terrible lymphoma, and T for retrosternal thyroid is what you need to remember. So उसमें अगर एक थाइमोमा है तो थाइमोमा जब एक्सपैंड होके रिब ने उसको प्रेस करेगा और you will get this kind of ripple like indentation, which is called wave sign, seen in the pediatric population whenever they are having a normal thymus. So doctor, with this we will conclude आज के चाय पे चर्चा कार्यक्रम विद डॉक्टर मुरली भारद्वाज, आपके फरमाइश से, right? So every day evening we will all meet up, study together. So don't forget to subscribe to onlinembbs.com video library, where you have 1500 HD videos along with the PowerPoints. All these PowerPoints are made available, and these are also made available in the Incus learning app. So take every opportunity, prepare well, be part of our learning community on the Incus. Upload the videos, share the videos, like the videos, fan them, follow them, make friends, and enjoy a combined preparation. Good night and see you all tomorrow. Thank you.